Ontario has reported the highest number of deaths from COVID-19 this week since the spring. Data from the Ministry of Health shows that 109 people have died from the virus in the past 7 days, which is up from 67 the week before. Manisa Danabalan has more on what we can expect in the coming winter months and details on the new COVID-19 treatment that's being approved by Health Canada.
The number of deaths reported this week is a total we haven't seen since May. Epidemiologist Timothy Sly says he's concerned that people are getting too comfortable and we should be more cautious heading into winter.
We've got fewer people wearing protection. They think somehow that it's over. It's certainly not over. We're also seeing the time of year, of course. And thirdly, we're seeing now a return of those other respiratory diseases that we hadn't seen for the last 2+ years. We are also seeing the emergence of some more subvariants.
Dr. Brendan Liu from Hamilton Public Health recommends getting our booster shots and wearing masks in crowded areas.
So COVID-19 still continues to be a present threat to our health and as well as to our healthcare system. And there's a number of competing pressures that we know exist, including all those other respiratory illnesses that we tend to see in the fall and winter, as well as all that catch up and care that needs to continue to happen in the healthcare system.
Dr. Zain Chagla says the spike in the number of deaths could be from more activity in the community.
It's tragic, every single one of them. When we were in the worst of COVID back in early 2021, we were seeing that figure in a given day, and we're talking about that figure in a given week.
Chagla also spoke about the new COVID-19 treatment that's been approved by Health Canada. He says Evusheld, which is a muscular injection, is already being used to prevent people from getting COVID-19. And now it can also be used to stop high-risk people from getting more sick when they test positive.
The study suggested 50% reduction in hospitalization in people who get it early within the first 7 days of their symptoms. And, it gives more options, right? We do have drugs like Paxlovid, which is an antiviral. We have remdesivir, which is an antiviral.
He says it's effective against all the Omicron variants and still being tested whether it would be effective against emerging variants. Manisa Danabalan, CHCH News.